Yeah. There are currently 2,737 people in hospital, including 189 people in ICU, of whom 78 are ventilated. There were 13,333 positive tests returned in the 24 hours, including 7,077 positive rapid antigen tests and 6,256 positive PCR tests. Those positive PCR tests, that 6,256 positive PCR tests, were returned from 37,463 PCR tests. So thank you everyone for continuing to get tested, and please remember, if you've got symptoms, please stay at home and get a test. Today I will be giving more details, as I do on the weekly summary of the deaths, to give people a sense of the underlying vaccination conditions that people are dying with COVID, and also the vaccination status. But before I do, I'm announcing that there's 35 people have sadly died of COVID in the last 24 hours, 20 men and 15 women. Of the 35 people who died, one person was in their 40s, 2 people were in their 60s, 6 people were in their 70s, 11 were in their 80s, 14 people were in their 90s, and 1 person was more than 100 years old. Can I pass on my condolences to the families for their loss? 8 people had received 3 doses of the COVID vaccine, 15 had received 2 doses, and 12 people were not vaccinated. We're also today announcing an additional 35 deaths that have occurred in the period from the 2nd of January through to the 20th of January in aged care facilities in southwestern Sydney. You can imagine that this has been a very busy time for southwestern Sydney, when they're experiencing quite a number of cases of COVID, and we've had a number of outbreaks in aged care facilities. And so whilst the local health district has been working with the Commonwealth and the aged care facilities to support and focus on the response, there was a delay in reporting those deaths to the ministry for the purposes of the statewide reporting. In the media release, it details the dates on which those deaths occurred, and they're from that 2nd of January through to the 20th of January. We have reached out to all our other local health districts to ensure that the processes are streamlined for the reporting for statewide reporting purposes, and we've been no additional issues have been identified to date. So can I also pass on my condolences for those who have lost their loved ones. In terms of the summary of deaths for the last week, from the 21st of January through to the 27th of January 2020, and these do not include the additional 35 that we've indicated. There'll only be a small overlap with that on one day, being the 20th. But of those 210 deaths in the last week, 192 were in people over the age of 65 years. 43 of those died in aged care facilities, 147 died at hospital, and 2 died at home. Of those who died at home, there was a gentleman in his 60s and a gentleman in his 80s. 1 was not vaccinated and 1 had received 2 doses of the vaccine. In terms of the 18 deaths that were reported in those under 65 years of age, 1 person was in their 30s, 2 people were in their 40s, 10 in their 50s, and 5 in their early 60s. 8 of those 18 individuals were not vaccinated. And the 1 person who died that did not have significant comorbidities was in that unvaccinated group. So 8 were not vaccinated, 1 had 1 dose, 8 had 2 doses, and only 1 had received 3 doses. So again, it stresses the importance of the booster dose for protecting you, but also protecting those around you. I'm also going to give you an indication of the significant comorbidities. Now, this is challenging because people often have multiple underlying conditions. So when I report the numbers against each category, it will mean that some people are in multiple categories, so the numbers won't add up to the 18. But 2 had significant cardiac disease, 2 had significant obesity, 3 had chronic pulmonary disease, 1 had asthma, 4 had diabetes, 2 had chronic kidney disease, 1 had severe liver disease, 6 had cancers, 1 had severe mental illness, 3 were on a palliative care pathway pre-COVID, and 3 had some very rare genetic severe conditions. So obviously it is tragic to see that loss, but again it highlights the importance. We want everyone to get boosted, but I particularly want people who have got chronic conditions affecting their neurological systems, their hearts, their lungs, their livers and kidneys, or that are overweight or obese, to get vaccinated, and the elderly to get that booster dose. We know for greatest protection against the Omicron variant, we need that 3rd dose. So please do not delay. And please, we always assume that information's got out very widely. But I think we who are engaged with COVID day in, day out, forget that many members of the community may not have had the opportunity to hear the message that the booster is recommended for 3 months now. The interval's 3 months. So can I urge everyone in the community to just check with your loved ones, check that they've heard that message, and really facilitate them getting the vaccine as soon as possible.